So our next speaker is going to respond to the comments from Rick and from Lynn and others is Paul Farmer, and of course Paul, being an icon of global health that he is, needs no introduction. But I think in the interest of fairness, I should probably give an introduction. Paul is a physician and an anthropologist and a founder of Partners in Health. At Harvard, he is the Colocatronis University Professor and Chair of the Department of Global Health and Social Medicine. He's also the chief at the medical school, and he's the chief of the Division of Global Health Equity at Brigham and Women's Hospital. He also, interestingly, is a representative of the UN. He's a special advisor and Undersecretary General on Community-Based Medicine and Lessons from Haiti. And he's written a lot on health and human rights. I think many of us have grown up on his books in the company of, well, that's the last one. But he's written about pathologies of power. He's written AIDS and Accusation. Most recently, he's written In the Company of the Poor, Conversations with Dr. Paul Farmer and Dr. Gustavo Gutierrez, Reimagining Global Health, which we use as sort of a textbook for our global health course, To Repair the World.
To be replaced by
Paul
Randy's.
Farmer Speaks to the Next Generation, and a number of other books. So after speaking to the next generation, Paul is now going to speak to us. Paul.
Thank you. Thank you. Thank you, Lynette. You know, I'm sitting rather than standing because I have I got hit by a car, which is an interesting way to talk about accountability, right? Because if I had listened to my mother, right, look both ways before you cross the street, then I wouldn't have been hit by a car. However, I was a Harvard medical student and not a Haitian woman with 6 kids. And so I got taken to, by the way, I had no idea I was going to say this until I had already told the gentleman behind the camera that I was going to stand. Then I realized, I really can't, don't want to. So that popped in, thanks to, of course, historians talking about why accountability is not the same as unaccountable. And I will continue this line of thought, watching the clock. And I never used to tell this story because some months afterwards, I couldn't walk unassisted for 6 months. I was a Harvard medical student, as I said. I didn't talk about it because it smacked of the worst kind of identity politics, and among those least well-placed to invoke them. But recently, I have spoken to some of my students about, well, what would be the equivalent of this argument this outrage that we're speaking, that we all feel, and also the joy of one another's company has been brought up many times. If the problem of colonial medicine, of transnational practices that clearly won't defy any kind of serious historical scrutiny, if the basic problem is not the belief that some people are worth less than others, then what is it exactly? And since we haven't managed to use accountability and a host of other potentially reparative terms to address this, maybe, as Doris was just saying to me, maybe it's the unaccountable that we should be looking at. And we do. I'm not adding anything. I'm not adding anything original. But again, if I had not been a Harvard medical student crossing a busy street in Cambridge, then that is exactly what I would have heard. You should have looked both ways before you crossed the street. You should have had, family planning, or you should have not had family planning. You should have used a condom. You shouldn't have smoked. You shouldn't be drinking water from a place where people practice open defecation. And I think that is a theme in it's certainly a theme in Lynette's and Rick's presentations, about which I'm to comment. But I do hope that we will continue to get back to asking that question. We can't enforce the belief that all lives have equal value, clearly. But there are legal remedies, as we've heard. There are moral engagements and mobilization, mass mobilizations, resistance from below, as Randy was reminding us, was the only way many changes were made. Rob's work is another example. Doris has reminded us how we can invoke the arts broadly conceived in a quest to make there be less unnecessary suffering in the world. So this thread, I mean, we're all looking for this global golden thread, and for me, it's that one that that historians may be corrupted, as Randy reminded us, saying, hey, they were historians working for the tobacco industry, but history probably not so much. And because if it can be recovered, and Alan, thank you. Alan reminded us that maybe we wouldn't have, I mean, maybe it would have been just as, thank you, Jen, just as plausible to not have recovered those archives, or just as plausible in the cholera case to not, I mean, we found a smoking gun letter for the IDB case. Didn't matter. And when Sinead was asking about, yeah, but is there a paper trail when we're talking about standards of care for Ebola? Oh, yeah, there's plenty of paper trails. There's emails. It's not just overheard conversations. That hasn't been always the problem, that we don't have the documentation. And so I want to start with that appreciation for Alan's framing. Unaccountable and accountability are two different things. It's like the buzzwords talking about Raymond Williams, keywords, you can pervert resilience, that's now gone, empowerment, self-empowerment, effectiveness, and a potentially useful tool like cost effectiveness, in which development economists driven by ideologies aren't even making a distinction between cost and price, which you don't need an undergraduate degree to I mean, you could be a Haitian mother of 6 crossing a street, and you'd know the difference between cost and price. So I don't want to sound philosophical. It's my least favorite arena in academics. Whereas the empirical work that you're all doing is my favorite part. So Lynette and Rick, I just want to note that both of these presentations and the work of both Lynette and Rick, as our colleagues from Haiti and those working with them, only regard legal remedies as one part of a complex set of engagements towards a goal. And it's a goal that we understand to be against the goals of others, and how difficult it is when these opposing camps, you hear an epidemiologist say, hey, I'm a researcher. I'm a public health guy, I'm not a filmmaker. Well, I know a lot of the public health guys and gals who were actually favoring the policies that said, we're not going to treat drug-resistant TB, or it's not possible, cost-effective or sustainable to treat AIDS in Africa, or surgical disease like getting hit by a car. That's trauma. You can't do that in Sierra Leone. You can't do, and it's not just passive. Well, it's impossible. It's not feasible, so it'll go away. It's actually, as you have seen in all of these examples, an active attempt. And I'm not sure when it started. Historians can always say, oh no, it was before that. And they're always right, by the way, because they're using archives. But I don't know when it started, but it is clear to me, as someone who began medical school in 1984 after a year in Haiti, that there was active discouragement for redistribution after the ills of empire, right? When Mario said yesterday, we don't have the resources here anymore. They've been removed. So he's using a historical and processual analysis of why Haiti's poor when it was the richest colony on the face of the earth. And that's why I'm not trying to brown nose Randy, Alan, Marcos if he's around, by always talking about history. It's because it's our only hope of recovery of memory that would serve us in looking for the unaccountable. Now, I just want to say, again, with great admiration for the project, to start with Lynette's. This is such a rich, it's very painful, as you can imagine, Lynette, for me to even hear about it, because this is a long-standing battle, even in the specificities of drug-resistant TB, HIV. Randy has written a classic book called White Plague, Black Labor, which was published in the 80s, which lays this out, this being what you describe. It lays it out very clearly with every reference to the complexities of drug resistance, what predated apartheid, aka colonial rule of longstanding, and there's got to be a different feeling for people, in listening, for those who have either contemplated these problems in their scholarly work or taking care of the patients, and all I can say is I think this kind of work has a better chance of pushing forward accountability by showing how unaccountable various parties remain in these long-standing struggles. And to go to Rick's question, which he asked last night as well in conversation, about legal remedies and institutions that claim immunity. As you heard yesterday, I'm not a stranger to this debate, right? Having been involved in attempts, I can't even determine whether or not they were successful. I thought not. I was cheered by my lawyer friends yesterday, who were probably just trying to calm me down and, to say, no, it was not a wasted effort. This is the IDB suit, right? The Inter-American Development Bank. Solomon and I have been talking about this for years around the World Health Organization. And again, we're all part of these. That's the other thing, is you're part of a world. You're part of a post World War II order. So the thing that struck me, Rick, was that since we all come from different worlds and are part of the same one, a point made by poets again and again over the centuries. When you start talking about fear of inflation, I'm a physician anthropologist. I can hardly remember what inflation is, or what it means. Its technical definitions, I mean. But what is really, there's Marcos, there's my other historian. What is really striking is why have a fear of inflation, but almost no fear of the deaths that would be obviously caused, or the failure to save. It's just as, I think obviously caused is fine. That's a claim of causality that we can back up, as you and Rob have shown. But with such an absolute lack of fear of that catastrophic and altogether predictable consequence, right? Same with mining in South Africa, anywhere in Southern Africa, right? The people we take care of in Lesotho, 80% of them are those sent home to die, right? Now, here's the thing I'd like to use to kick off the conversation, after saying, okay, fear of inflation, fear of bad publicity, fear of lawsuits, fear of reputational damage, but really not a lot of fear of death, disability, and injury among the poor. And it's just striking, right? And it's striking that, it's striking in its, its repetition generation after generation. And so I want to just open this up by proposing something. Again, following a discussion with Doris and hearing Alan speak. When I was forced by my grandmothers to go to Catholic indoctrination propaganda, my parents actually, this is getting to be very autobiographical, and now I'm thinking, why am I doing this on camera? I had no interest, and I couldn't wait for it to be over. seemed entirely, I mean, all of it, right? And my parents didn't really care, but those Catholic grandmothers, they have a force, right? And it wasn't until I went to Haiti that I looked and said, well, corporal works of mercy, I remember that from CCD, like little Catholic indoctrination camp. And the corporal works of mercy, unlike the professionalism that divides us, that is, into medicine, public health, law, the humanities, all the terms we've used, political science, all the terms we've used to describe ourselves, policymakers, ambassadors who are actually also scholars, don't forget, and awesome people if you just get off that damn bike. The corporal works of mercy are pretty straightforward and quite old, as in at least 2 millennia. Feed the hungry, clothe the naked. There's 7 of them, and I'll always, in a public space, get this panicky feeling I had in front of one of my grandmothers, not the other one, that I would get it wrong. Bury the dead, visit the prisoners, etc. And I ask you humbly, are these really as liable to perversion as notions like cost effectiveness, accountability, sustainability is one of the worst offenders, right? I mean, sustainability now it's a diagnostic test, right? You're saying, oh, that is sustainable or that is not. It's defining a state of whether or not something is worthy of support. Same as cost effectiveness. So it is a notion that has been taken and perverted and robbed of its meaning, like empowerment. When the first Global Fund application, sorry, I'm watching the clock, but when the first Global Fund applications were written, which, by the way, again, raises a problem that Randy and Marcos brought up. It's like, why can't states do this, right? Well, states are, the Treaty of Westphalia, I don't know when that was, but states are a fairly recent creation, too. When? Yeah, I mean, there were empires after that, right? But the Global Fund did something that as do the corporal works of mercy. Gustavo Gutierrez is right. They move resources, or are supposed to, from those who have too many of them to those who have too few of them. And those resources could be, restricted freedom, right? Being a prisoner. So if you're a free person or a well person or a wealthy person or a whatever is defined as the right color to be person, and you're talking about the corporal works of mercy, which is almost never happens in universities, by the way. I mean, it's just there are places in even a huge university where you'd be scoffed at for suggesting that we go to think about some of these basic lessons about how to interact with others as if we believe they might have the same value that we do. Now, that's why I beg. I mean, you compare the corporal works of mercy as recited by some, old Sunday school teacher. I'm sure there are Protestant versions of it, although my grandmothers would roll in their graves if I had any association with them. And you compare them to the SDGs, they're just as good, right? And probably less liable to perversion in the way that each of you has brought up. Now, the collaboration between people like Lynette and others who understand legal and political process or training, or Beatrice, or Brian or Mario, and Mario's word yesterday where he said, and doctors, right? But it's not about the professions of law and medicine. It's about the solidarity on behalf of social justice that is reparative and acknowledges that history encompasses humans who have caused great damages to others because of this belief that there are some lives that are fundamentally less valuable. And let me just say, cholera, any discussion of cholera that doesn't point out that case fatality rates, even if you get cholera, which some of my medical colleagues did in the middle of a cholera epidemic, of course. We also got tuberculosis, occupationally or otherwise acquired HIV. I mean, none of Ebola, right? But if we don't focus on inequalities of outcome all along the line, risk, aka social determinants, public health Luddites are perfectly happy to talk about social determinants. They're not so happy to talk about the expense it would take to redistribute money so that the man that Lynette spoke of in a legal case that was successful, even though he died, right? And that is come up with every example. And that's what Gene was trying to say about Ebola, right? It's bad to get Ebola. You know, it's bad to get smallpox. I'm sure it was bad, right? It's bad to get tuberculosis of any kind. It's bad to get cholera. It's bad to get hit by a car. It's bad to have obstructed labor. But what happens next needs to be important no matter where we're sitting and how we're getting at this, is what happens next. And I think that's why it's so emotionally difficult to hear about not just the epidemics themselves, right? Or the epidemics of gender inequality, you know, and which now we're probably going to ruin the term GBV, right? But the epidemics I'm talking about are syndemics of plagues of all sorts. Many of them have nothing to do with a communicable agent in the classical sense. But if in each of these instances, without exception, the biggest problem that is before us, I believe, is not only the risk, the differential risk, I will stop, but the differential risk for not having anyone give a shit about what happens to you afterwards. No pun intended. Because the people who do have cholera, and we treated 70,000 of them, right, in Haiti alone, in the first 2 years. Case fatality is supposed to be 0. Case fatality of TB is supposed to be 0. Case fatality of getting hit by a car in Cambridge, you know, and breaking all the bones in one of your leg is supposed to be 0. Case fatality of Ebola, we don't know what it's supposed to be, but we can tell you, as Gene did, that no American, white American, who contracted Ebola died. And 70% of our African colleagues, I'm talking about medical colleagues, people my age, people who are my age fare poorly. It's the young and healthy who survived, and who knows how many of them survived because they actually received any of the T in the ETU, right? So this is this is what I, this is how I'm responding to Lynette's awesome and inspiring work and presentation, and Rick's awesome and inspiring. Remedies that don't include, thinking about the corporal works of mercy are doomed to be regarded by the future Randall Packards and Alan Brandts and Marcos Cuetas as inadequate. And, I think that that's what Alan was getting at by drawing a distinction between accountability as, again, like sustainability, something, and the notion of unaccountable. And I hope that's useful. And I can tell you one thing, and this is my last line. If we don't pay attention to things that get dryly called case fatality rates, right? One of the corporal works of mercy is to bury the dead. We'll have a lot more dead to bury. That much is sure. Thank you.